Good day, students. This is Dean Raskob talking to you from the OU Hudson College of Public Health on the University of Oklahoma Health Sciences Center campus. Welcome to our continued discussion of government health insurance programs in Chapter 11 in the textbook, and the next segment in our consideration of these government programs. The material I'm going to review with you today is the material that would be covered in the lecture of March 25 as it is outlined on your syllabus. And specifically today, we're going to deal with the Children's Health Insurance Program, or CHIP. Now, before I go into today's material, I just want to say a couple things. Again, we appreciate your patience and your thoughtfulness as we're doing this teaching by new methodology and format. You will notice that I did place a extra credit opportunity up on Canvas yesterday, and really hope that we can use what we're seeing in real time in front of us with the COVID-19 pandemic as a learning opportunity for all of you with regards to public health, and in this case, public health policy. So the extra credit opportunity really builds on what's being observed with the COVID-19 and asks you to consider some policy actions. I think it's all self-explanatory there. If you do and complete that by the deadline, you may receive up to 2 points directly to your final grade. Finally, I will be putting up 1 or 2 more extra credit opportunities in the next few days, possibly even tomorrow, but certainly by early next week. And again, for you to have opportunity to self-study and to gain extra credit. Now let's go into the material for today's discussion. And this again is about the Children's Health Insurance Program. Now, the Children's Health Insurance Program is a 10-year, $40 billion block grant program that was created in 1997. And the goal of this is to provide health insurance to low-income children where their family income is above the eligibility for Medicaid in their state. Now, the book outlines the history of this program. It went through multiple legislative revisions. It was reauthorized in 2009 under the CHIP-RA, or CHIP reauthorization. This was extended further in the Affordable Care Act, such that it went out through 2019. And then various other bills, as outlined on the text, page 249, have extended this funding so that this is continuous now through 2027. Now, the CHIP program is an optional program for states, but all 50 states participate. Now, the remaining of our discussion today will talk about the structure of CHIP, the financing, the eligibility for these programs, what benefits are provided, and then one consideration of the future. Now, there are 3 ways that states can participate in the Children's Health Insurance Program, and those are listed. They can incorporate the CHIP into their Medicaid program by using CHIP-eligible children as an expansion population under Medicaid expansion. Secondly, they can create a separate CHIPS program. Only 2 states do that. And they can create a hybrid program where some CHIP children are in Medicaid and others are in a separate CHIP program. All 3 of these options are used by states, as you see here. But a point to illustrate here is that this just again illustrates and underscores the complexity of our health system and our health coverage system in the country. Look at these different options, and then we have a combination of Medicaid and not, and nothing is really easy and simple with these programs. And I think that's a theme that you'll see over and over coming through, whether we're talking about government health insurance or private insurance. Now, CHIP is financed by a federal state matching program similar to how Medicaid is financed. there is what's called an enhanced match, or EMAP, and the CHIP matching is more generous, or always higher than the state's Medicaid matching program. Again, here we see some key bullet points as to the history and situation with this. Historically, the the CHIP program was covered by anywhere from 65% to 81.5% by the federal government, again, depending on the state's income, per capita income. The Affordable Care Act raised that to the numbers shown, and then finally in 2016, it was documented that the federal government covered, through either the expansion, through the various ways, the three mechanisms that CHIP could be undertaken by the states. Federal government covered 92.5% of the CHIP spending, which came to $15.6 billion there. Now, the EMAP, again, the mapping ranged from 88 to 100% in 2019. The states receive payments in two-year allotments. These are capped because this is a block grant program. Remember, at the beginning of this chapter, we talked about the distinction between entitlement programs and block grants and what that means. CHIP is a block grant program, which means that the amount of spending by the federal government on this is capped, regardless of how many potential eligible individuals there are who may want to participate. So Table 11.4 in your textbook, which is shown on this slide, compares the key features of Medicaid and CHIP, and this is very important. Medicaid is an entitlement. Anyone who's eligible and enrolled will get the benefits, and there's not a cap on that spending, whereas the block grant program puts some limits on it, and this is again favored by those who are taking a more fiscal orientation and focus to these type of healthcare benefits for our population of low-income individuals. So you see some differences here in the slide, and the federal-state matching is common to both, but CHIP is matched at a higher rate than Medicaid. Now, the states may cover children up to 300% of the federal poverty level. We reviewed that in the last lecture. For one individual, federal poverty level for one person is about $12,000. For a family of 8, it's somewhere in the range of $44,000. So this is not a high level of income, and therefore 3 times that, or 300%, is the ceiling up to which states may decide to cover children. And this varies across different states. The states set the income requirements, so the income requirements are the level of federal poverty level that they will set as being eligible for enrollment. This applies to children younger than 19 years who have no other health insurance and who are not eligible, generally eligible for Medicaid. Now, the states may impose waiting periods, enrollment caps, other measures to limit expenses through CHIP. Now, this leads to an initial discussion question that I would like you to give thought to as you're thinking about this. You know, Medicaid was created as an entitlement program, but CHIP was established as a block grant. What is the logic for this distinction? They're both designed to serve the same purpose, bring health insurance to very low-income individuals. What is the impact of being a block grant versus a entitlement program? And should one or the other changed to align these? And what structure do you prefer as a constituent, or often in line with your policy viewpoints or your political viewpoints? Think about these questions, but I think that you see they really reflect, again, part of those tensions about the view of what the purpose of this government health insurance is, who should be entitled to it, An entitlement program means that you're guaranteeing this to many more people, to more people, whereas the block grant is capping off the contribution. And then what are the political implications with respect to that? Very important thoughts and questions, particularly as we go forward in this election year, and we'll say more about that when we come to talk about health reform. Now, the benefits CHIP provides, they must provide basic benefits, and those are listed in the slide, of course. All of these services. Age-appropriate immunizations is crucial. This is fundamental to taking care of children and to protecting our society from outbreaks of infectious diseases, for example, such as measles, mumps, and rubella. Now, there may be additional benefits that CHIP programs want to provide, such as prescription drugs, mental health, and so forth, and again, highly variable by states. 5 states cover pregnant women, 16 cover the unborn child, which is a way of fundamentally covering the pregnant woman with respect to the CHIP benefits. Now, CHIP does provide some coverage for immigrant children in several states and for immigrant pregnant women. And the important distinction here is that it does not require the 5-year waiting time that we see previously for Medicaid. Again, the way these benefit packages are designed is by linking them to benchmark plans. This is discussed on page 251. Again, this is complicated and creates a lot of detail and confusion and a lot of administrative need for oversight and so on. But essentially, the state must pick a benchmark plan and then define their benefit packages under the CHIP to that. So an important distinction here, though, is in general, Medicaid provides more comprehensive benefits than CHIP. So a child, if eligible, enrolled under Medicaid, may get more comprehensive benefits than in CHIP. So thinking about CHIP, historically, some policymakers have wanted to follow private insurance models instead of the Medicaid model. States have the choice to implement a more generous or a more limited CHIP program, and this, of course, relates to a number of variables that influence this decision. But again, we get back to a debate, again, fundamentally in public health between the social justice and the market justice thinking. What is the government's role? What is its responsibility? What level of benefits and coverage should it be providing? Should it be providing most comprehensive protective approach, or should it be providing just a coverage that's equivalent to private insurance? Remember, the whole purpose of these government programs are trying to address Medicaid, CHIP, and then we'll talk about Medicare, is that historically the private market has not stepped in or been able to create products that meet this need for these low-income individuals. So think deeply about these questions also, because they do influence our thinking about health reform, and they will be topics of discussion probably with the upcoming election. Finally, states may apply to the federal government for waivers of CHIP requirements, just as we discussed with Medicaid. They may cover pregnant women without a waiver, but older adults, the government is not granting waivers at this time. They can look at providing some type of premium assistance to people with a waiver. And so you can see, again, these are complicated. These waivers mean that states will tweak or adjust their CHIP program and experiment with new ways of providing that program to their population. Well, historically, before the Affordable Care Act, generally there was quite good bipartisan support for the Children's Health Insurance Program, generally, because you can appreciate it's very challenging to be labeled as a politician who doesn't support children, of course, and that's part of the political calculus in this. Now, with the Affordable Care Act and its highly charged political nature, and as more children were trying to be rolled under full health and coverage with the Affordable Care Act, the uncertainty about that Affordable Care Act means that they may be challenged. And so to whether that coverage continues or not, depending on the status and the future of the Affordable Care Act, which, as you know, has a Supreme Court case where it has been challenged as unconstitutional. So this political controversy and partisanship only underscores what was recognized back in 1997 as the need for a separate program, a separate CHIP program, and I think that that's just evidenced even more so in our current situation because of the partisan nature of this in our Congress with respect to health reform, health coverage, and how we do that. I think that there will be people who will want to move CHIP off of a block grant to another program, and as you know, there are people who want to move Medicaid to a sort of a block grant program, which is what our governor in Oklahoma has proposed doing. So more about this when we come forward on health reform. Now that covers what I would like you to know about the Children's Health Insurance Program. Recognize that this is a crucial program that covers up to 40% of all children in the United States get their health insurance through this program, through the CHIP, either in combination with Medicaid or through one of the three structures that may exist for this Children's Health Program. 40% of all children in America. And that's really a profound statement and indicates the seriousness and the need for this program. That concludes the discussion about the Children's Health Insurance Program, and I wish you a good day. If you have questions, email them in. We'll do our best to respond to that. I've put the Canvas app on my phone, and so we'll work to communicate with you through Canvas as well. And watch for future announcements about other ideas I have to stay connected with you and to be able to garner some type of interaction, personal interaction on some of this content. Thank you very much, and good luck.